Hi there, my name's Ashmit and I'm a third year medical student, and today I want to educate the men out there on one of the most painful and relatively common medical emergencies that you could experience. Something that actually happened to me not too long ago. Fortunately, I had a really good outcome and I'm completely fine and healthy now, but many guys aren't so lucky. So in today's video, I'm going to be sharing with you my story, my experience with testicular torsion. I'll talk a bit about what it is, how it presents, and how things like stigma and comments like "it will pass" cause very bad outcomes. So sharp groin or testicular pain that comes out of nowhere, you might think it will pass just the same way I did, and it nearly cost me a testicle. If you're a guy or you know a guy who you deeply care about, watch this video, it may actually save them. So just a quick disclaimer, although I am a medical student, this video is not medical advice. This video is purely educational, and everything I'll be talking about is backed by actual research out there that I will present. So my goal here isn't to give anyone medical advice, rather it's to present existing research on the topic and also share my experience. So if you have acute testicular pain or lower abdominal pain right now, pause the video and go get yourself checked out. So firstly, torsion is when the testicle twists on the spermatic cord, essentially cutting off blood supply to the testicle itself. And just like any other organ or part of the body, the testicle also needs a constant blood supply, otherwise it will die. And the clock starts the second it twists. So normally testicular torsion presents with a constant aching pain in the testicle or the groin, but in my case, it was very different because the testicle briefly twists and untwists. That's what happened in my case. It's a very rare presentation. So essentially the pain comes in waves rather than being a constant pain. So my pain was like, it was a stabbing pain and then it would ease. So it'd come about a few times a minute or a few times even an hour. And see, that's the trap, right? Because when you ease, you think it's fine. But then one episode, it actually lasted much longer and it caused me a deeper ache and I nearly waited it out. And when I got in, I got assessed and actually ended up having surgery. So before I talk more about my story and exactly what happened to me, I want to list out some red flags. If you encounter sudden severe testicular pain, which radiates to the groin or the lower abdomen, but in my case, it just stayed in the testicles, or you've got swelling, some accompanying symptoms could be nausea, vomiting, or a pain that wakes you up at night, or in my case, if you have intermittent attacks of pain in your testicle, you need to go to the hospital. This isn't one of those things where you talk to your primary care physician about, or your GP. You need to get to the hospital as soon as you can. So any one of those symptoms that I've just listed and testicular pain, go to the hospital. So I was visiting Manchester with my friends on a Saturday, and that's when it happened. We were on the train and I started having intermittent pain in my right testicle. So every few minutes this pain would come on. It would be a very aching, like stabbing kind of pain. So I called up my dad, who's an orthopedic surgeon, so in the medical field himself. I said, look, I don't think this is testicular torsion, right? Because this is like a pulsating kind of pain that comes on every few minutes, a few times an hour. It's not giving me too many problems. I mean, it does hurt when it comes on, but it's very unlikely to be testicular torsion. And then we both thought it was some sort of infection, which seemed likely. It was a Saturday, so I said, I'll go get it checked out on a Monday. He said, just keep an eye on it in case the pain persists. We were both very convinced that it wasn't testicular torsion. And then I told my friends, who are all medical students too, and they had very interesting differentials themselves, but testicular torsion seemed very unlikely at the time. So absolutely nothing happened on Sunday. The day after, on Monday, I woke up and I was like, yeah, I've got that pain again. It's actually gotten much worse. And it really started hurting. The pain was still intermittent. And by this point, it had been 48 hours since I first started experiencing symptoms. It was an intermittent pain. It was getting a bit worse. So I said, you know what, I'm going to go to the hospital. My mum called me up. She said, hey, how are you? I said, oh, by the way, I'm literally in the A&E. She says, oh, what's going on? And I told her. She was a bit surprised. She didn't think it was testicular torsion either. I called my dad up. He was at work. He didn't think it was testicular torsion either. So I was just relaxing in the A&E. I hadn't eaten any food. I got examined by this really, really intelligent FY2 doctor. This guy's really smart. I mean, testicular torsion, we're taught in medical school that it's a constant kind of pain. We're taught a lot about it, but we aren't really taught about the fact that the pain can very rarely be intermittent, where the twisting isn't constant, but it twists and untwists, which is what causes the intermittent pain. But somehow this FY2 had a very strong suspicion that that was happening. He noticed that my testes were swelling up, and he referred me to another hospital. And he said that we'll send you there for further evaluation. He still did believe that it was most likely just an infection, not testicular torsion. And before going to the hospital, I got myself some food. I was really hungry. And when we got to the hospital, they checked me out. They did an ultrasound. The ultrasound failed to diagnose testicular torsion. So ultrasounds are usually used to look at blood flow. And in the case of testicular torsion, there is reduced blood flow to the testes. Now, unfortunately, or fortunately, my presentation was of a twisting, untwisting nature, an intermittent pain nature. They couldn't diagnose my testicular torsion through an ultrasound, but they still had a very strong suspicion that I had testicular torsion. And my pain was getting worse, so they said, we're going to do this thing called an exploratory surgery. And I heard that and I was so scared. I was genuinely terrified. I was like, this is crazy. I still think I kept myself, brave. And I called up my dad. I said, yo, these guys want to operate on me. And the consultant at the hospital, really nice. The consultant and his registrar, really nice people. They spoke to my dad, told him what's going on, explained to him that we're gonna have to do surgery on your kid. At this point, my dad's voice started trembling. He was on speaker, and I was like, damn, this guy's really worried about me. And I found that a bit funny. Another funny moment over the phone, my dad asked me if I were nil by mouth, which means, have you eaten food before surgery? You're not meant to eat food or drink before surgery. And I did. I'd literally eaten an hour and a half ago, and he was not happy. And we had a laugh over that. And then my dad tells my mum, who, mind you, she's in London. I'm all the way up in Leeds, 4.5, 5 hours away by drive. So by the time she'd have reached Leeds, I would have been operated. I'd be hopefully much better. So anyway, I had surgery. I wasn't very anxious when I got to the operating theatre. We were cracking jokes. It was really nice. So when I finally woke up after the surgery, I was surrounded by nurses who were looking after me. I wasn't very out of it. By the time they shifted me to the ward, I had to stay there overnight because they wanted to observe me, and it was really late in the night. They operated me at like 7-8 p.m, so I had to stay there overnight. A few things went down that night, and this is where my story gets a little bit personal. This is a video that I didn't really want to make because, yeah, the story's a bit personal. And the things I'm about to disclose, I still don't know if it's if I should. But essentially, I kind of became a baby overnight. There was a point where the wound where they, went into my testicle from, it started bleeding because I had to use a toilet. I had to take off, the dressing. I took off the dressing in the toilet, and I literally had a full-on panic attack. Like, I saw myself bleeding out of my testes, and from the wound, not the actual testes. And that was horrifying to see. Honestly, it was the scariest thing. I've never actually had this bad of a panic attack in my life. The only other times I've had panic attacks were in sixth form when I was giving some of my exams. But it was really sad. I went pale, I collapsed on the ground. The nurse came and she looked after me. It was really sweet. And I started crying to her, saying that, I want my mum, where's my mum? And it was just really sad. So the nurse was really sweet. She sat me down, looked after me, took care of me. So I genuinely believe that's the most vulnerable I've ever been in my whole life. And I really thank the nurses and the doctors who looked after me there. They treated me like a kid. So, well, my mum did arrive. She did look after me, but she couldn't stay for very long. They weren't allowed to have her there for very long, but she did stay overnight in Leeds, and she took me home the following morning. I did have another panic attack later on when I had to use the toilet again because the dressing came off and I was still bleeding. And it is a really strange thing, like seeing yourself bleed from, the wound in your testes, and then your testes are super inflamed anyway. It's a pretty horrifying thing to see. And yeah, I do consider myself someone who is emotional but very strong. I don't tend to really panic in situations like these, but when it happens to yourself, and I've even noticed when something like this or something serious happens to a loved one, you stop thinking, and that's completely fine. There's nothing wrong with that. And yeah, to all the men out there, it is okay to be vulnerable with those you love, with those that love you, and with doctors and nurses. They are there to look after you. So in a few days, I took my bandage off. I was actually completely fine. I was back to running within a week or two. In fact, the very next day after my surgery, I had to go back to Leeds to do my research work and stuff. I was very persistent on that, and my parents weren't too happy, but I was fine. I made a very, very quick and smooth recovery. I'm very happy to say that I'm completely fine. I read my post-op notes as well. Those showed that I will have a very good outcome, so I'm completely fine. I'm very happy about this. But unfortunately, some men aren't so lucky. So if you have a presentation of testicular torsion, here's what to do step by step. Stop everything. Tell anyone around you that you have to go to the hospital. Go to the emergency room, the A&E, and tell them that you've got testicular pain or groin pain, and highlight the fact that you've got suspected testicular torsion. Again, remember, do not have any food or drink like I did in case you need surgery. And also, when you get to the hospital, do not panic. The people there, they will sort of rush you because it is a serious thing. So expect an urgent examination, an ultrasound, someone examining your testicles, and expect immediate surgery even without imaging. So what happened to me is they did this thing called an orchidopexy. Or in my case, they did a bilateral orchidopexy because they found this thing called a bell clapper deformity, which is what's seen in people who are predisposed to testicular torsion, especially people who are having testicular torsion. So basically, an orchidopexy is when they fix the testicle in place and they secure both sides. Of bilateral orchidopexy, as I discussed earlier, because if your anatomy predisposes you to having torsion in one testicle, it may happen in the other as well. So the recovery is straightforward. You just have to rest for a bit. You're given this thing called a scrotal support. A short break from activity, so don't move around too much. You don't want to exert your groin because you don't want those stitches to come undone. And the best part is the anxiety vanish, and the pain goes instantly. So in most cases, yeah, you will have a good outcome if you get yourself checked out in time. So let me go through some myths versus facts that I put together. I'm going to give a statement, and I'd like you to tell me if you think this is a myth or a fact. So here's the first one. If pain eases, it's fine. Well, this is a myth. The fact is, intermittent torsion can untwist temporarily. It's still an emergency. If at any point you do have testicular pain, you need to get that checked out, even if that pain resolves, which is kind of what happened to me. It's a teen issue only. Well, this is a myth as well. Now, although yes, testicular torsion is most common in teenagers, it happened to me when I was 19, it can still happen at any age. Ultrasound first, always. Now, if suspicion is high, surgery shouldn't be delayed for imaging, and oftentimes, based on what I've read in the literature, a lot of surgeons will just take you to the operating theatre and do surgery on you. So a lot of people do have post-op questions, things that I've read online, and questions that I had myself that I was fortunate enough to ask to the surgeons over there, and also other doctors that we know. So can you still play sports after surgery? The answer is yes. After clearance, you can. So a short rest for a few weeks, and then a steady, gradual return. Will this impact your fertility? I asked this question to my surgeons. They gave me a very interesting answer. They said, do you have a child? I said, no. They said, well, because we have no indication of what your fertility is like right now, we don't know how it will be impacted post-surgery. But early treatment does protect your fertility, but delays can harm it. In my case, fortunately, everything was fine. I was restored. So this should not impact my fertility. So why are both sides fixed in testicular torsion surgery? Again, like I talked about earlier, it's a preventative measure. If you have this thing called a bell clapper deformity, and most times, even if you have testicular torsion, fixing both sides will reduce the risk of testicular torsion on the other side as well. So what if it's epididymitis instead, which is what me and my dad initially thought when I had sort of like a pulsating intermittent pain. Let the doctors assess you, but if you do have testicular pain, go to the hospital, let them do their thing. If it's an infection, that's fine. Take antibiotics, go home. I'd briefly like to talk a bit more about how speed saves testicles. So if you get checked out within 6 hours of your presentation, the salvage rate appears to be 97 to 100%. If it's between 7 and 12 hours, it's 80%. And then between 13 to 24 hours, it drops down to 54%. And if you get yourself checked out after 24 hours, it's 18%. Now, these statistics aren't that clear cut. And again, I got checked out after 48 hours, but again, my situation was very different. It wasn't a constant torsion. There wasn't a constant lack of blood supply to my testicle. It was a very intermittent one. So blood was still getting through. My testicle survived. It was completely fine. So after I had testicular torsion and I recovered, I talked a bit about it on my social media. And someone told my sister after seeing my Instagram story, and they told her that I shouldn't share this because it's an intimate area. Now, here's the problem with notions like these. Embarrassment and not knowing the signs are leading reasons guys delay care. Not just for testicular torsion, but in general, that's why guys delay care. Sharing stories like these literally saves futures. And unfortunately, there were people in my close circle, people very close to me, who weren't very happy about the fact that I was talking on social media about my torsion episode. But here's the thing, talking about these things are important. People need to be aware. There is so much qualitative evidence out there that shows embarrassment or a lack of knowledge even leads to a late presentation. Adolescent data out there also echoes the same thing. Fear of making a fuss also causes delays. Usually testicular torsion affects one testicle, so if you lose one testicle, the other testicle is still healthy, and most men keep normal testosterone and fertility as per studies. Now, yes, apparently some men can see lower semen quality after a torsion episode, and a small minority develop low testosterone, so follow-ups like these matter. And also, if you have had testicular torsion, and unfortunately, God forbid, you do lose your testicle, if appearance is something that worries you, testicular prostheses are a thing, and many guys report better body image and satisfaction after placement. So I just want to say, if this video stops even one person from waiting, that's a win. So share this with your friends, your brothers, your dad, your children, any man out there who you care about, and drop questions in the comments. I can't answer these questions, but I will try to get a urologist to answer them for you. And if you've had testicular torsion, or you know someone who has testicular torsion, with their permission, of course, I'd love to hear your story. So that brings me to the end of this video. I hope you enjoyed listening to my story, and please subscribe for more men's health and med related content. Thank you.